The videos of the low back pain program are divided into 4 categories. The first one, which is the limited mobility exercises, takes into account any limited mobility, strength, range of motion, flexibility, and discomfort that you may have even before you begin. This category is to help you relieve tension and to lengthen tight muscles and joints. It also helps to realign your joints, improve range of motion, and to increase your flexibility. It will take significant time for you to progress while at this level. It is very important that you complete this level in order to move on to the next one. And once you master them, you won't be required to practice them anymore unless your tightness returns. The next level, which are the progressive exercises, are meant to strengthen weakened muscles, add stability to unstable muscle groups, and to reinstate your flexibility. This level requires more strength training and balance. In time, you will only need to perform these exercises as needed. The third level, which are the challenging exercises, will improve your stability, balance, and strength at longer durations. This level requires the most effort and balance of all categories. And although these exercises may not be easy at first, they will become easier as your strength, flexibility, and balance develops. You may want to perform them occasionally after some extensive time of training. Lastly, the maintenance exercises are meant to keep you conditioned to perform and function effectively as you perform more complex movements and tasks. This level requires the least amount of time but the most effort in execution. Do them weekly and you'll find them easier to perform in between and with your everyday movements as they are intended to be functional and practical. Now when you begin the program, be sure to start at the first level and exercise and go up in sequence. This is to prevent any discomfort as you progress to the next exercise and level safely. When you begin these exercises, spend about 1 minute per exercise. This will be for either a movement or stretch depending on what you are working on. 1 minute is the minimum amount of time that you will spend for each one. As you improve, increase the time an additional 30 seconds to extend between 2 to 5 minutes. To make the program more convenient and effective for you, break up the routine to 3 times per day. Generally, when you get out of bed, then in the middle of the day if you are feeling sore, and as a prevention just before you return to bed. To help you manage your time with the program, only do 3 exercises per day. Start with the first 3 and work your way up with an additional exercise each time. You can start the next exercise as long as one of the first 3 have become very easy to do. This is the time to add a new exercise while omitting one of the originals. This is not a strict rule, so it's okay to add a few more or less in addition. As long as you are averaging about 3 exercises, it will be easier for you to manage the program. Because you'll be experiencing new movements and stretches which you are not used to, your body will require more time to rest and recover. Spend at least 1 to 2 days per week as a rest period where you are not on the program. Before you begin, make sure that you get consent from your doctor. You don't want to risk any injury or suffer more pain on a new program that may be unsuitable for you. Prior approval from your doctor is important before you begin. This way, if you have any specific injuries or conditions, you'll be able to minimize any exercises that may be in the program that would not be beneficial. If you're experiencing any type of immediate injury such as a bone fracture, herniated disc, or sharp nervous pain, just put the program on hold until your doctor gives you the consent to continue. For some of us with back pain, you may also have knee issues. This may affect how well you can perform some of the exercises, which may mean that you may either need to practice them less often, less intensively, or even omit some. Although this will mean that you'll be performing fewer exercises, there are more than enough in the program to help make up for the ones you have omitted. Now, to help you as you progress through the program, here are some tips. Go only at your pace. There's no need to rush through any of the exercises. Aim for improved flexibility while at the same time relieving stiffness. You may find it easier to perform some of the exercises, while others may take much longer than you expect. The timelines indicated are only a general rule, as our bodies each heal and recover at different rates. To help you stretch and strengthen safely, always practice the exercises partially and in short incremental movements. Only move a few inches or degrees at a time daily. This will prevent unnecessary injury and from overstraining yourself. Use any type of support to help maintain your balance and to remain stable. Be sure that you are using comfortable, loose clothing that won't affect your movements. You can help to protect your back, knees, or other joints by sitting on a soft mat, cushion, or carpet. Once you get the hang of some of the exercises, add them to your daily routine, such as when you feel discomfort while at the office or at home, you can practice the seated lunge. Anytime you want to lean forward or bend down, reverse lunge and kneel instead. If you are sore from standing, you can practice standing abdominals or squats to help relieve pain. Don't give up any current treatments, hobbies, or sports activities while on the program. It is important to continue with the activities that you love to do as long as they are safe for your spine and don't cause unnecessary strain. As a final tip, it is important to be committed and persistent in the program. It's normal to have ups and downs and days where you can accomplish most of the exercises very well, while some days where you'll only want to rest. Don't allow any new challenges to discourage you. Just be persistent and confident. Each exercise has a specific benefit for relieving your back pain. In time, you'll notice the changes as your flexibility improves, your recovery becomes faster, you heal quicker, and your ability to recondition yourself from injury becomes much more effective. Finally, stay relaxed and stay committed. Expect good days and bad days, but know that your relief will come as you correct your muscle imbalances. Be sure to prioritize your needs. Your back safety and health comes first at all times. Don't neglect caring for your back and don't overstrain it. Make sure that you enjoy the program. Some exercises may be uncomfortable, but the strain will go away. As you progress, there will be added relief with each exercise and level. Remember that this program is not a magic bullet. It takes time, patience, and dedication. It's your back, and your health is worth the effort. If at any time you need support, just contact me at info@lowbackpainprogram.com. I always respond to every email within a few business days, and I will do my best to help you with the program. For additional support, go to the ebook instructions link and it will help you with many topics not covered in this video. Also check out the ebook support facts and other frequently asked questions. There you will find many answers to questions from many users of the program to help relieve your pain. Before you begin the program, make sure to read the video disclaimer. I would like to thank you for using the Low Back Pain program, and I wish you the greatest relief and recovery possible.